All right, today we're tackling a big one, genetic screening. It's this incredible medical technology that, in a way, lets us peek into the future. But as you can imagine, that glimpse comes with some really profound choices and some deeply personal questions.
I mean, just think about it for a second. What if a single test could tell you about the genetic makeup of your unborn child? It's a powerful thought, right? It opens up this whole world of possibilities, but wow, it also opens up a whole lot of questions. So, to really get a handle on how heavy these questions can be, the material we're looking at gives us a hypothetical case. And I think walking through it is the best way to see what's truly at stake here.
So let's set the scene. Imagine a 42-year-old mother. She's pregnant with her fourth child, and she's just going in for a routine checkup. Everything seems to be going just fine, but then her visit ends with a pretty complex recommendation from her doctor.
Okay, so here are the specifics of this hypothetical situation. The patient, as we said, is 42 and pregnant. Now, her doctor's concern is about the increased risk of Down syndrome for the fetus. See, once you're over 40, that risk goes up to about 1 in every 100 births. So because of that risk factor, the doctor suggests she undergo genetic screening, specifically a procedure called amniocentesis.
All right, so that brings up a big question. What exactly is this procedure, amniocentesis? To really get what this mother is facing, we kind of have to zoom out and understand the science of genetic screening in general.
Okay, so at its most basic level, genetic screening is a way to look at a fetus's genetic makeup. The whole point is to check for chromosomal disorders, things like Trisomy 21, which is what causes Down syndrome, and other potential genetic issues. Now, the case we're talking about mentioned amniocentesis, but that's just one of the common ways to do this. There's another one called chorionic villi sampling. They're different procedures for sure, but they both have the same goal, to get a really clear picture of the fetus's genes. Okay, so we get what it is. But why do it? Well, genetic screening really has 4 main goals, and it's worth noting that these are widely seen as, pretty commendable reasons. So let's break down those 4 aims. First, there's research, just helping to advance our scientific knowledge. Second is the possibility of early therapy, trying to treat a condition before it can cause too much damage. The third one is all about preparation, helping parents get ready emotionally, financially, for a child who might have special needs. And lastly, there's future planning, helping parents make informed decisions about having more children down the line. And this is a really crucial point from the source material. The procedures themselves are considered super safe. We're talking practically no harm. And those 4 purposes we just went over, they're generally considered ethically sound, even commendable. So that kind of makes you wonder, right? If the procedure is safe and the goals are all good, then where does all the debate come in? Where's the controversy? Well, this is where it starts to get really, really complex. So let's dive right into those ethical issues, because this isn't really about the science anymore. It's about the very human side of it all. It's about navigating all those gray areas. And really, this whole ethical conversation boils down to 3 key ideas: consent, privacy, and stigma. So let's take a look at each one. First up, free and informed consent. And this one is absolutely non-negotiable. Screening has to be voluntary 100% of the time. That means the patient needs to have all the information: what the procedure is like, what the goals are, any burdens, any side effects, the whole shebang. They need all of that before they make a decision. It's all about making sure the patient is the one in the driver's seat. Okay, so next step after consent is the proper use of the information you get back. I mean, getting a test result is one thing, but actually understanding what it means, that's a whole different ballgame. There's a very real risk that parents could misunderstand just how serious a condition is or what the consequences might be. There is a massive ethical weight that comes with delivering this kind of news.
And that brings us to the third pillar: confidentiality and the risk of stigmatization. The results of these tests have to be kept private, absolutely. And why is that so important? Well, it's to avoid the danger of creating social stigmas. This awful idea of labeling people with genetic differences as somehow being less than. This really gets to the heart of how we, as a society, think about and treat people with disabilities. So here we are, right back where we started, circling back to that central question from our source material. What are the ethical questions that we really need to be asking ourselves when we talk about screening for genetic defects? Look, the technology is incredible. It can give us more answers than ever before. But the real challenge for each of us and for all of us together isn't about the answers. It's about figuring out which questions are the right ones to be asking in the first place. And that is the conversation that truly matters. Thanks for tuning in.